Welcome to our comprehensive overview of vasculitis, its types, diagnostics, and key USMLE facts. First, large vessel vasculitis, temporal arteritis, also known as giant cell arteritis or GCA. Imagine a 72-year-old woman with a new unilateral headache and jaw pain while chewing her morning bagel. Her ESR is 110 mmHg. Key diagnostic, jaw claudication plus a high ESR. USMLE fact. There's a risk of irreversible blindness. Start high-dose steroids immediately before biopsy. Next, large vessel, Takayasu arteritis. Consider a 28-year-old Asian female with malaise and cold hands. On exam, her radial pulse is 2+ on the right, but absent on the left. A bruit is heard over the subclavian artery. Key diagnostic, pulseless disease in a young female. USMLE fact. This condition involves the aortic arch and its proximal branches. Moving to medium vessel, polyarteritis nodosa or PAN. A 45-year-old man with hepatitis B presents with episodic abdominal pain after meals and foot drop. Angiography shows string of pearls microaneurysms in the renal arteries. Key diagnostic, hepatitis B association, mesenteric ischemia, and the string of pearls sign. USMLE fact. PAN characteristically spares the lungs. Next, medium vessel, Kawasaki disease. A 4-year-old boy has had a fever for 6 days. He has bright red cracked lips and a strawberry tongue. He also has peeling skin on his fingertips. Key diagnostic, crash and burn, conjunctivitis, rash, adenopathy, strawberry tongue, hands, feet, edema, peeling, and fever. USMLE fact. There's a risk of coronary artery aneurysms. Treat with IVIG and aspirin. Now, small vessel, granulomatosis with polyangiitis or Wegener's. A 40-year-old man presents with chronic sinusitis, bloody sputum, and rapidly rising creatinine. Nasal exam shows a saddle nose deformity. Key diagnostic, the triad of upper respiratory, lower respiratory, and renal involvement. USMLE fact. It's PR3 ANCA, C ANCA positive. Treat with cyclophosphamide. Next, small vessel, microscopic polyangiitis. A patient presents with palpable purpura on the legs and signs of glomerulonephritis. Unlike Wegener's, there is no involvement of the nasopharynx and no granulomas on biopsy. Key diagnostic, lung and renal symptoms only. USMLE fact. It's MPO ANCA, P ANCA positive. Next, small vessel, eosinophilic granulomatosis with polyangiitis or Churg-Strauss. A 35-year-old woman with severe asthma and nasal polyps presents with new numbness in her hand. She also has a high peripheral eosinophil count. Key diagnostic, asthma, eosinophilia, and vasculitis. USMLE fact. It's P ANCA positive and can cause IgE-mediated issues. Next, small vessel, IgA vasculitis, also known as Henoch-Schönlein purpura. A 7-year-old boy presents with colicky abdominal pain and palpable purpura on his buttocks and legs. This occurred 2 weeks after a cold. Key diagnostic, child, purpura, GI pain, and hematuria. USMLE fact. It's the most common childhood vasculitis, with IgA immune complex deposition. Next, small vessel, cryoglobulinemic vasculitis. A patient with hepatitis C presents with joint pain, fatigue, and purple spots on their legs. Labs show low C4 complement levels. Key diagnostic, hepatitis C association and cold precipitable proteins. USMLE fact. Often presents with peripheral neuropathy and glomerulonephritis. Finally, various Beckett syndrome. A 25-year-old man of Turkish descent presents with painful recurrent oral ulcers, genital ulcers, and uveitis. He develops a sterile bump after a simple needle prick. Key diagnostic, oral and genital ulcers plus uveitis. Thank you for joining us in understanding vasculitis. We hope this overview helps in your medical studies and practice.